Thank you. Thank you all for attending this session today. Always good to see people who are interested in learning about a serious disease. So thank you all for coming today. And the team which is doing this hard work actually in organizing, I understand it's not easy to get people together, especially on a Saturday afternoon. So big kudos to you guys. I'm a doctor, so I'll probably take this opportunity, given that there are a lot of females here and younger ones as well in here. Maybe I can share some facts, basically, as how you can actually help yourself maybe prevent breast cancer. The thing we are talking about is early diagnosis, so we can treat. That's what we do most of the time. But as doctors, we don't get opportunity to talk about what things can we do actually in the first place to reduce the risk of actually getting breast cancer. In this country, every year about 17,000 women get diagnosed with breast cancer. Of that, 3,000 actually get die. Men also get breast cancer. It's not very common, but about 300 a year, of which about 30 die. But it's a major health issue. Breast cancer being the commonest cancer in women in this country, and the second commonest cause of death in women, only followed after by colorectal cancer or bowel cancer. So it's a major health issue. So what causes cancer? And before I talk about breast cancer, just like to say, what is cancer? Cancer is not an alien disease. It doesn't come from outside. It's not a virus or anything like that. It's your own cell in your body, and we have about 50 trillion cells in our body. Of that, the cell which, say, in the morning when you wake up, you see some hair falls, your skin sheds off. There's a normal process of somewhere around a month where a cell falls off, dies. What happens in cancer is that process is actually lost. So your normal cell in a body, be anywhere, that's why you can get cancer any part of your body. That process of actually control of how a cell should die doesn't happen. So in respect to breast, you have what's called lobules, which make milk. Then you have a plumbing system called ducts. The commonest cancer, 90% of the cancers arise from the ducts of the breast, which is basically the channel which takes the milk to the nipple. Less of the other type. Breast cancer, we could, just call it breast cancer, but there are many different types, or at least 20 different types of breast cancers. That is our doctor's actually responsibility to sub-classify, and then, because treatments are a little bit different. For your information, just understand, at the moment, in this country, or most Western countries where breast cancer is almost in 1 in 7 women now, you need to actually be able to pick them early. Okay, so the only hope we have as doctors in terms of managing a cancer, any type of cancer, is picking them early, because it's your cell which goes disarray, so it's very hard to kill them, and by the time it's actually giving any real signs or symptoms, it's usually about 2 million cells anywhere, so it's very hard to actually stop it spreading. So early examination, as you know, you must know by now, every woman, at least at the shower time once a month, make sure you examine your breasts, and you are the best knower of your breast in terms of which size is bigger or smaller, shape. Any change in shape and size is you can actually detect much earlier than anybody else. Any change in texture of the breast, is there a lump or something you can feel? Just so examine. Usually, you need to lift your hands up, because if there's a dimple or something in the breast, it's more obvious when you lift your arm up. The other thing is to make sure you examine your armpit, because breast tissue starts from there, and most of the cancers, about 70% of the cancer actually arises near the armpit, not truly in the breast, but on the corner of the breast. So picking up cancer is very important early. That's the only way, when somebody mentioned that we are able to treat the breast cancer, is because the mammography or the x-rays of the breast that we do is a modality in which we are able to pick very early breast cancer. So very early breast cancer means ductal carcinoma in situ, or lobular carcinoma in situ, means that the cancer is confined either to the lobule or to the duct. And if we are able to pick that, and that's what X-ray or the mammogram does, it picks calcification and other things. So when you take that out, the cancer hasn't gone out. So that's why you can actually treat it. And if cancer has actually breached the layer, the ducts and the lobules, if it's any early stage, definitely less than 10 millimeter, you can still treat it. If it's less than 20 millimeter, definite hope of treatment. But after 2 centimeter, any cancer in the body is actually very difficult to treat. It actually spreads throughout the body. So picking up early is the biggest hope. Okay, so I wanted to actually say a few words about how do we prevent this. It's more important. So make sure, take this with you and share it with your daughters and other families. One of the most important reasons why we are getting cancers is because of the change of lifestyle that we are living. And this is to do with our diet, with all the things that we are exposed to in a Western country. And sadly, any migrant group which moves from their native country to a Western country, the risk of getting any type of cancer increases rapidly. And this is stress, as you understand, the daily highway of your life, because you are not able to actually manage your hormone secretion in your body. So it's very important, and somebody mentioned about yoga. So meditation, yoga, exercises, walking, all these things are very important to incorporate in your daily life so that you are able to manage your stress, because you can't, because houses are at $1 million a year and you are bloody under mortgage, you are running at 5 o'clock, traffic, manager shouting at you, your friends are gossiping behind you, you are home, your children are not letting you sleep, that's it. Your life, 16 hours of your 24 hours of your life is going under. This is stress, nothing else. So to manage this is very important, because it's not only that you can't sleep well, because sleep is very important, 7 to 8 hours sleep is very important for good health, but because in your body chemicals, which are very good chemical mediators and hormones that are secreted to balance your body, is not done. So you are exposed, your genes actually become dysregulated. They become upregulated in sense of bad genes. And bad genes is the end part of all these things that actually cause cancer, be it breast or be it brain or anywhere. So food, we have changed eating food, okay? These are now scientifically proven that high animal meat, especially red meat, saturated fat, especially animal derived, make sure you cut down as much as you can, because breast is a hormonal organ. Meat has what's called zenolol, a synthetic estrogen in it, which is very high promoter of hormones in the body. So that's how meat damages, and apart from moral, ethical things, that's a side of, but what it does to your body is the hormone amplification in yourself. So try and teach your family. It's important to understand this. The other thing is alcohol, and this is a new trend. Last 10-15 years, and how the breast cancer incidence, although we have better techniques of picking them up, that there's a true increase in the number of breast cancers that we are getting. Alcohol is getting very common in women now. There was a time only men drank, and women just didn't pick it. Now everyone is getting colored drinks and flavored drink or whatever you call them, and you're drinking at any type and every type of alcohol has a high risk of actually causing, especially breast cancer. So make sure you reduce the amount. Even wine, although wine has red color with resveratrol and other things in it which increases your antioxidants, but overall if you look at the studies, the alcohol part is not very conducive, because it actually damages your liver, it produces again the estrogen effect in your breast. So your food, your make sure drinks and other stuff like your daily eating that we are now stuck with all this outside there, fast food, they are not actually suited to our body. They cause a lot of damage, chemical damage in our body. So as a group which is not a medical group, I think it's important that if I can share some of these studies that show if you eat properly, you have a proper understanding of what to drink and how to look after your lifestyle, managing your stress, obesity, if you are too fat, it's very hard to actually, any type of disease occurs in your body. obviously older age, as you get older, because your immune system goes down, so you need to actually make sure as you are getting older, your body is not actually as suited as a 25-year-old tense of immune system, and COVID has actually taught a very good lesson.